Healthcare executives today have to deal with a lot of change. From an organization standpoint, there are so many that I think they're probably all top priorities, to be honest. Probably with the one that comes to mind most relevantly is the regulatory change associated with the Affordable Care Act. Whether it's on the payer or the provider side of the business, it's driving immense change in only the business models that are being driven, the pay patterns, the buy patterns, a complete change across the business. From that comes really a focus on more of a consumer-centric or customer-centric environment. It's an operating model that hospitals and insurance companies just aren't used to, period. And most of the executives of those top health plans and organizations have been focused on delivering their pieces of operations and their business, not really focused on the consumer. So a complete change there. Finally, I think probably maybe the biggest is really cost pressure. Whether it's administrative cost pressure, the cost of care, from an operations standpoint, it's continually driving organizations to be more efficient, to be leaner, and to look at how they deliver their business. Those are probably the top three. Traditional operations, a lot of the work has been done manually. In an advanced operating model, you're employing analytics, so taking data and turning it into information. You're employing rapid automation or robotic technology and manual labor in a very lean manner. When you take the combination of those three ingredients, you end up with a pretty good recipe. How does it advantage a health plan? Where a health plan can apply more of an advanced operating model to the processes that will adopt that, they can see 30–40% efficiency gain and cost reduction associated with that. And like we talked about before, healthcare has been slow to adopt advanced models, but where they have, they've seen significant reduction and much leaner process. The healthcare payer today, from an end-to-end operations standpoint, is struggling with what's known as their ALR, their administrative loss ratio. Typically, an industry benchmark around an administrative loss ratio is for, say, a healthcare or a blue plan, is somewhere in the 18% range. Applying a very lean, a very advanced operating model like we've talked about and some disruptive BPO can drive that to the 10–12% range. The industry leaders that are within the healthcare payer space are driving a 10% ALR today. So when you get behind the veil of what's actually being delivered and you talk about re-engineering a business process and having multiple years of driving change in large companies, Genpact is the one with the deep level of experience in doing that. Using our Lean Six Sigma approach, we actually get down to the keystroke level of detail associated with what's going on with an organization, and we transform that process. So the difference between us and our competitors clearly is experience. Being able to look at regular business process outsourcing technology and delivery in more of a disruptive fashion and take that and apply it with the history that we've done and the number of times that we've done it for our former parent company, GE, brings a unique skill set.